Dedicated Minds. I wish I knew more about this band. Like, I don't even know who's singing. All I know is that there's a Chamorro guy who worked at the... What's that big drum store in the States? Like San Diego area? Or the big music store?
They specialize in drums?
Or what's the big music store?
Guitar Center?
Yeah, probably. I don't know. This guy.
That's a great name for a band, a Dedicated Minds.
Guitar Center? Oh, Dedicated Minds, yeah.
That's a great name.
Yeah. So anyway, I heard there was a Chamorro guy working at this place, and they were just recorded like in the store. But that's all I know. We only have a couple songs. I actually got sent over when I was running 94 way back, man, like 2004, 2005. Good stuff.
We got a pretty dedicated mind in the Zoom room right now.
We sure do. Nice seg, Jay.
A part of a team that has worked tirelessly to get us through and hopefully strive throughout the pandemic. Our good friend Janela Carrera, the Public Information Officer at Public Health. Good morning, Janela. Good to see you.
Hey, good morning, guys. Been a while.
It has. Welcome back. We're doing good. Well, let's just go ahead and get right into it. So, you know, the POO is ending, guys, and they're hiring over at the Department of Public Health and Social Services. I don't know if anyone at POO is qualified for this job, but we covered last week, Janela, the impending departure of the Chief Medical Officer, Dr. Felix Cabrera, right?
Yeah, that's right. So he did submit a leave of absence, an extended leave of absence as CMO, but he is continuing to serve or finish out his clinical duties at the Northern Region Community Health Center until September 17th, and then he'll start his leave of absence for an indefinite period. So in the meantime, we are continuing our search for an acting CMO. Hopefully we'll make that announcement soon.
Right. We were just kind of wondering off line here. So prior to Dr. Cabrera, it was Dr. Chris Dombrowski for like a hot minute. And then prior to Dr. Dombrowski...
Gosh, I even forgot about that. Dr. Dombrowski.
Dr. Maglotnia was before Dombrowski, right?
That's right. She was our medical director. And then Dr. Dombrowski was our acting medical director. And then we hired Dr. Cabrera as our chief medical officer.
Right. 8:58 now on the link. Janela, I know that you guys are doing a bunch of outreach this week, right?
Yeah, so, you know, we've been doing outreach throughout this entire pandemic, but we do have a very busy schedule. You know, we continue with COVID-19 vaccination clinic. Throughout this week, we are at the UOG field house. We're continuing at the Micronesia Mall on Thursday and Saturday. And then, of course, we have our vaccination clinic at the Northern Public Health. We also have it at our Southern Public Health, which is in Ilahan. And then we also have testing ongoing, of course, at the old medical grounds. But we also have testing that we're offering at the Southern Region Community Health Center in Ilahan as well. So we're very busy in terms of outreach for testing and vaccination as well.
Right. So that's something new, guys. All my Southern people, because I know they're always asking me about opportunities for testing and vaccination. So it's testing is going on at the Southern Community Health Center?
Yes, that's correct. That's on Friday, September 17th from 8 a.m. to 12 p.m. We are going to have testing that we're offering there at the Southern Region Community Health Center.
Well, that's good to hear. Janela, I know there was some talk about, and I want to go back to like Forever 21. There was some discussion about what we were going to do with that, and then I think that kind of went by the wayside because now we're at UOG. But is there any discussion that you can share with us about opening up another permanent testing site, or are we going to kind of do this, spread them out on different days of the week that we're seeing like this week?
Yeah, so we were eyeing the possibility of having another vaccination clinic over at the Forever 21 location at the GPO. That was something that we were looking at, and we were engaging with the management at GPO along with the Guam National Guard. Unfortunately, it just didn't pan out. And so we did disengage. We were actually looking at that as a possibility of both a vaccination clinic as well as an infusion center, but more for prophylactic purposes. So what we're doing at this time is we're actually working with Mangilao Mayor Alan Ungakta to use the Mangilao Senior Citizen Center as an infusion center, and we'll hopefully have that stood up by this week, maybe in the next few days. And so that's for the monoclonal antibody treatment.
Right.
So Forever 21, I think at this point, it's not, it just didn't pan out. Maybe, I don't know, in the future, maybe we'll have talks, but at this time, it's not a location that we're going to be using.
Just real quick, Janelle, I don't know if you have info on this, but we did have a comment earlier about the Mangilao night market. Did Public Health do an inspection there on Thursday that you know of?
I'm not aware of that. I'd have to check back with the team to find out if that was one of the locations that we went out to visit.
Yeah, I know, Janela. We also had another comment. I think there was a follow up to that one. Somebody was saying, do you know of anything if people or if Public Health has required vendors like at night markets or anything like that to get to be vaccinated?
Yeah, what's the protocol on that, if you know?
Okay, yeah, I'll have to find out. I'm not sure if night markets are part of the covered establishments that need to have, vaccination requirements. I have to look at the guidance memo again. Yeah. Because I know that, eating and drinking establishments, of course, especially if you're dining in, but for takeout purposes, it's not a necessity. For night markets, I can't recall if they were listed. I'd have to look at the. Yeah. I don't have it in front of me, so
I don't have
to look
it
at it
either.
Yeah.
Oh, but I wonder though, because like at a night market, a night market when I used to go, this is way before COVID, you would get like your lumpia or whatever your drink, and you'd like walking around eating it. So I wonder how that works. If it's just strictly takeout, or anyway, I don't know.
Right. Yeah. Yeah, I'm trying to recall if it was part of the list of covered establishments. Especially if you're outdoors and it's a you're really just going there to pick up food. It's kind of like when you're in a mall setting, right? And you're not sitting down to eat, but you're just kind of walking around, going in and out of stalls to pick up items for purchase. So. I don't recall if it was in the covered establishment, so I'd have to take a look.
I hate to hit you with another kind of like, did you hear about this one? But just while we got you here, we also were tracking, I believe Saturday, and then this was confirmed by Dr. Wen, because I think he might have responded to it. But there was an adverse reaction to vaccine being administered at UOG Fieldhouse on Saturday. Did you hear anything about that yet?
I have not heard anything about that, but anytime that there is an adverse reaction, it should be immediately reported to VAERS, which is the standard reporting system. And usually it would have to be reported by the institution or the clinic where the adverse reaction occurred. So if it was at UOG, then the clinicians or the authorities who were there who observed it would have to be the ones to report it. And then we also encourage patients who may be experiencing adverse reactions, say at home or after they've been released, to also report it. There's actually, usually while being observed, they can actually, or even right after they receive their dose, they can actually register on the VAERS system, the adverse reporting system themselves. So they can actually be monitored for the duration of their vaccination, so that they can actually tell the system whether they're experiencing any type of symptoms or if they're feeling fine. So there is a way to report these symptoms.
Do we?
But I have not heard of that particular one on Saturday.
Oh, okay. Well, I will confirm it probably with the guard and the doctor. But do we track like local submissions to the VAERS system? And what are we seeing?
Unless it's reported to us,
then
we do keep track of it if it's reported to us. But if it's something that, say, for example, is just something that occurred at home or was not reported to a medical professional here locally, then obviously there's no, we're not aware of it. But if it's an event, say for example, that required medical attention, further medical attention, required a patient to be taken by ambulance to the hospital, or some kind of clinical assessment, required an EpiPen, or trying to think of the word, just more medical attention,
Right.
then that is something that we will keep track of.
So do you know offhand if we've had any other submissions to it?
I know that in the early stages of the vaccine rollout campaign, we had a handful of them that we were aware of. There was one or two that required ambulance transport, emergency transport. There were maybe one or two that required further attention at the pod site, at the vaccination site.
Yeah.
And there was maybe one or two that were later reported to us, but this was maybe 1 or 2 or 3 days after the patient had gone home and then went to their physician and reported their adverse reaction to their physician. And we only became aware of it later down the road. But other than that, I'm not aware if there were any after that. It was probably something that was reported directly to the VAERS system or to their physician, and then reported to the VAERS system.
Do you know offhand what types of symptoms these people experienced?
Well, more than often, it's breathing difficulties, chest pains. Those are the more common ones. If it's more than just the standard, fever, chills, arm injection site pain, it usually has something to do with an allergic reaction, and then it's a respiratory type of issue.
Janela, you were talking about the monoclonal antibody treatment earlier. Where are we with did Public Health receive their shipment, and how soon are we going to start administering this treatment? I mean, I know we started last week or something like that, but where are we with it?
So the plan is, so we do have a Fema team that I believe is set to arrive sometime today. And then in the next day or so, the goal is to get them orientated and some training. And as I mentioned earlier, we are working with Mangilao Mayor Alan Ngakta and hopefully using the Mangilao Senior Citizen Center as an infusion site. And we'll, with the help of the Fema team, because we did announce that we are working, or we were approved for a request for assistance. Right. So with the Fema team, they will assist us in getting out these monoclonal antibody treatment to patients who were referred by physicians. So I think right now we have about maybe about 30 patients who are on standby to receive the treatment, the monoclonal antibody treatment. We did have an order that was pending last week and set to arrive on Friday. I believe that shipment did arrive. I'm not sure how many exactly arrived. And then we are on track. We're trying to order more, and so hopefully we'll be receiving more of the region code. So our target is to have that infusion center at the Mangilao Senior Citizen Center up and running by Wednesday.
Did we lose any of the monoclonal antibody treatment to temperature issues during shipment? Because I heard that
I'm not familiar with any of the any issues pertaining to that. I'm more familiar with the arrival of the Fema team and the target, but in terms of the shipment and all of that, I'd have to get back to it. I'd have to find out, but I'm not familiar with.
Okay.
Yeah.
But are we planning on standing up another infusion center, or is it just going to be the one in Milo?
For now, we're working with the Manila mayor, and of course, we also have GRMC and GMH as well, and so that has been a standard. We make referrals to both hospitals, and that's what we were doing prior to working with the Manila mayor. And so whenever there is a patient or anytime we have eligible criteria that's met at the Teason testing site, then a referral is made for them to get the treatment at either of the two hospitals. We've been working with GRMC very well. And so the goal is we want to have a third infusion site where we can have as many as, if possible, 80 patients a day. So with just the two hospitals, it's not possible to do that. But with adding this third site, perhaps we can reach that goal. And this is part of our layered approach.
Yeah.
It's part of our platform to try and reduce the number of COVID-19 spread in the island. It's vaccination, mask wearing, social distancing, and then on top of that, treatment of COVID-19 through monoclonal antibody therapy.
Just so you guys know, they're not opening an infusion in Mangilao. We're talking about an infusion center where they
Yeah.
receive the monoclonal antibody treatments. We had a caller earlier, Janela. So in order to receive the treatment, do you have to be referred by a physician? Because this lady had tested positive, and she said she'd asked for it, and she was turned down. So what is the actual protocol for it?
Right, yeah. So it is through a referral process, and there is an eligibility criteria. I don't have the list
We've
in front
had
of
it.
me.
Yeah, we've had it.
Okay,
Yeah.
yeah. So there is an eligibility criteria, and the minimum age is 12 years and older. And usually it's, you test positive for COVID-19. The priority really is for those who are unvaccinated, because they would typically be the ones who are more susceptible to severe illness.
Right.
But that doesn't exempt or that doesn't necessarily mean that those who are vaccinated are automatically disqualified. But there is a criteria to be met, and there's a certain comorbidities that a person may have, such as heart disease, other types of comorbidities that you may have that may qualify you to receive the monoclonal antibody therapy. And then, of course, a certain weight minimum requirement as well. And so the physician will make the determination and then refer you to receive the monoclonal antibody therapy.
Yeah, Bree was just asking if I asked about Fema. I did. I did.
Oh, okay.
I did, Mom. I did. So, Bree, they're going to open an infusion center in Mangilao. They've been working with Mayor Alan Ugata, and it's going to be stood up by the FEMA team. They've also got GMH, GRMC, but they're looking at another infusion site, right, Janela?
Right.
That's still in the works?
Was there like five sites or 3 sites? Because there's a team, 6 doctors, so a team of 5?
There's a team of, so we were, I believe it's a team of 20 FEMA, so it's 3 teams of 5. And then we also, there were 2 that came last week already from FEMA. And then I think there was another 2 that we're also anticipating. And they're all here to assist us with the infusion.
Mm-hmm. So where did the first team go? The first 2 teams?
I have to find out exactly where they're assisting us. I'm not sure if it's administrative duties that they're assisting us with or logistical duties.
I see.
But my understanding is the FEMA team that's set to arrive this week or tonight, they're all part of the infusion center that's assisting us on at the Manila Senior Center.
Did the monoclonal antibody treatment doses arrive?
So we were expecting them on Friday. That was what I was told. As far as, and I was telling Chris this earlier, I don't have the exact details on their arrival or what occurred. The information I have more on is as far as what we're trying to do in standing up the Infusion Center this coming Wednesday, which is our target.
Oh. And it's just at the Mangilao Senior Center? You said, did
Yes.
you say there was another site?
I don't have information on another location yet. So right now the focus is to try to get the Mangilao Senior Center up and running. So the FEMA team, they should be arriving sometime today. And then they'll undergo some training just to get them orientated with our team in the next day. And then our target is to have the Infusion Center up and running by Wednesday. That's the goal.
Okay. And again, for people who still aren't familiar with the treatment, there's certain criteria, right, that the person that tests positive has to meet. Can we go through that?
Sure, yeah. Let me just pull up the exact criteria.
Thank you,
real
Janela.
quick. Sure, no problem. Okay, so for minors who are the age of 12 to 17, because the minimum age is 12. And again, the individuals who would be receiving this are those who test positive. Eventually down the line, we would want to use this as a prophylactic measure. So for those who are exposed to COVID-19, but we're not there yet. For now, it's for those who test positive for COVID-19.
Mm-hmm.
So for minors 12 and older, minimum age is 12, and you'd have to be at least 80 pounds. The eligibility criteria is a BMI of within the 85th percentile, genetic, neurologic, or metabolic conditions, pregnancy, chronic kidney disease, diabetes, immunosuppressive disease or immunosuppressive treatment, cardiovascular disease, including congenital heart disease or hypertension, chronic lung disease, for example, chronic obstructive pulmonary disease, asthma, which is moderate to severe, interstitial lung disease, cystic fibrosis, and pulmonary hypertension, sickle cell disease, neurodevelopmental disorders, for example, cerebral palsy or other conditions that confer medical complexity, for example, genetic or metabolic syndromes and severe congenital anomalies, and having a medical-related technological dependence, for example, tracheostomy, gastrostomy, or positive pressure ventilation not related to COVID-19. So that's the criteria for minors. Mm-hmm. And then for adults, you would have to be at high risk for progression to severe COVID-19 and check one or more of the following. So this is the other criteria you'd have to meet. Older age, for example, older than 65, obesity, with a BMI of 25 or more, pregnancy, chronic kidney disease, diabetes, immunosuppressive disease or immunosuppressive treatment, cardiovascular disease, including congenital heart disease or hypertension, chronic lung diseases, sickle cell disease, neurodevelopmental disorders, which it's the same for minors, and then having a medical related technological dependence, which is similar to what I read for minors. Mm-hmm. So that's the minimum criteria. Mm-hmm. And then I think, one of the other things too is if your physician also determines that you also need to or are eligible to receive the treatment, then he can also refer you to receive it.
We reported that there was a shortage of the treatment, that GMH had ran out of doses, right? And that public health was putting people on a waiting list. Is that still happening? And if so, how many people are on this waiting list?
Yes, that's right. So last week, the island did run out. So we did run out of particularly the region code. So we were waiting for the shipment to arrive, and it was supposed to arrive on Friday. My understanding is that it did arrive. Now, as far as how many arrived and all of that, I don't have the details for that. But what we did have as a sort of as a backup was another monoclonal antibody treatment, which is called Lilly, and it's also monoclonal antibody therapy. It's obviously not the exact same combination drug therapy as region code, but it also is a monoclonal antibody therapy. So for those who may have wanted to or opted to receive that, they could. My understanding is I think we had about 30 individuals on the wait list to receive the region code. And so I'm not sure if all 30 are opting to receive the region code or if some of them may have opted to receive the Lilly, which is another monoclonal antibody therapy. But we did have 30 on the wait list for region code.
Mm-hmm. Are these EUA?
Region code?
These monoclonal, are they emergency use authorized? They're not fully approved yet?
Yes, that's correct. They're EUA.
Mm-hmm. Has there been any adverse reaction to these therapies?
I'm not aware of any that's been reported. I would probably have to check with either of the hospitals to see if any adverse reactions have been reported recently.
I already asked about the vaccine adverse reaction from this weekend.
Okay. Do you have any information on the planning for the booster shots?
Oh, yeah.
We would still have to wait for FDA approval, and then after FDA approval, the ACIP, CDC ACIP, to adopt that recommendation and also wait for their blessing as well, which is a standard process that we go through for all types of vaccines. So for the booster, it's the same process. Once that process is done, then locally here, we would also, which is the same process we've undergone with all vaccines. The VAPPC will likely also want to meet and discuss, and their responsibility would really just be for prioritization of the vaccine rollout for the boosters. And the likely procedure for that would be those who received it in the kind of the same category. When we did our first campaign or the vaccine rollout, we started with phase 1A, which was the healthcare personnel, and also I believe it was frontline workers, and then the elderly, the 75 and older. So likely go in that same phasing as well.
Are there?
It was about 8 months ago.
Right. Yeah. Are there any like manpower or staffing concerns? Because we're doing the monoclonal antibody treatment, we're expanding testing and vaccination efforts, and what this booster is going to entail. I mean, if you just look at it, we're basically starting the whole vaccination process all over again, right?
Right. Yeah. Well, I think. When the VAPPC meets, I think all of that will be discussed. The thing about with the vaccine or with the booster rollout is that it wasn't a large number of people that we were seeing. I think it was manageable in terms of how many people we were vaccinating at any given time. Unlike the time when we opened it up to the public. So we'll likely, and again, this is subject to what the VAPPC will have to discuss and approve. So I think we'll likely just use the standard vaccination pods in clinics but maybe make room for, especially our Manamku, because we do have our homebound vaccination. I believe it's through our 311 call centers. So we might just have to, figure out a schedule for them. So it's really going to have to, we're really going to have to work with the BAPPC to figure out how we're going to do this for the booster shots.
So Public Health's got the 2 medical technologists for the Public Health Lab. The 3 5-member teams from Fema are arriving, I guess, tonight. What about the update on the request to Fema for the vaccinators? When are they scheduled to arrive, and has that already been approved?
I'm not sure if that one has been approved. I'll have to find out. I know for the Infusion, the 20 teams, the 20-member team, that one was approved. I think that one is still in the works. And so we're hoping to receive word on that. My understanding, so, for the FEMA requests, it's obviously not just Guam that's making the request. This is nationwide, especially as we continue to see surges across the nation. So we have to compete for this. So hopefully we can get our request approved for vaccinators as well.
Thank you. You're good?
Yeah.
Yeah.
Was there anything else?
Anything else, Janela?
Yes, I do actually. I just, we announced that isolation clearance letters are available here at our office in Hessler. It's been a little slow. We don't see a lot of people coming here to pick up their isolation clearance letters.
What are these exactly,
So,
if you don't mind?
I'm sorry?
What are exactly is the isolation clearance letter? Is this for when you go back to work?
Yeah, so if, for example, someone who tested positive was obviously in isolation, right? So if they want to present the clearance letter to their employer, or if they're going to school, like UOG or GCC, they can pick up their isolation clearance letter here and then present it to their employer if they need it, or if they just want to have one, they can pick it up here, because we do get phone calls and they are asking for one.
Yeah.
But what we've done is we've just centralized it to a location where they can pick it up. So we have it here at our office in Hagatnya. And it's from 1 to 4 p.m. Monday through Thursday this week. And this is for those who tested positive between August 3rd to August 9th through September 3rd.
What's the process? Like, what do they need to bring? And then I also know someone who tested positive after September 3rd, but they're supposed to come back to work on this week.
Oh, okay. So if it's if they're still in isolation, then as the days clear, as their isolation period clears, then we'll continue to announce when those isolation clearance letters will be available for pickup.
So do they call, and then what do they need to bring if they're coming in person?
Just their ID.
Okay.
Just bring their ID.
Okay.
Yeah.
Thank you.
So they're probably not cleared yet because they're still in isolation.
Right. Yeah. You good, Ree?
Yeah.
Thank you, Janela.
Thank
Okay,
you.
thanks, guys.
Right
All right,
on.
take
Be
care.
safe.
Bye.
There you go. 9:30. Let's take a quick break, and we're coming back with your chance to win $500 US.